Well, let's take another perspective to this fight against COVID-19 in Nigeria. We'll be speaking with a medical professional. Dr. Aliyu Sokomba is the president of the Nigerian Association of Resident Doctors. He joins us from our Abuja studio this morning. Good morning, and thank you for joining us on the program. Now, I know that medical professionals are on the front line of this battle, and we are really grateful. I need to just put that out there. We are really grateful to, the medical professionals, doctors, nurses, and other people on the medical team. But, from what you have seen, heard from your colleagues, just how well prepared, how well protected, how well equipped are medical professionals in this fight against COVID-19 in Nigeria?
Thank you very much. Thank you for having me. I want to, first of all, start by letting you know that before the outbreak of the COVID-19 was recorded in Nigeria, Nigeria was already battling with the outbreak of Lassa fever in the country. And in a space of 12 weeks, 177 people have died from the Lassa fever outbreak in the country. This is far more than the total number of people that have been recorded to be positive, to have tested positive to the COVID-19 in the country. And in spite of the large number of deaths that have been recorded attributed to the Lassa fever outbreak in the country, very little attention has been paid to the Lassa fever outbreak. And I want to let you know that at the moment, the country is currently facing the world's largest outbreak of Lassa fever in the world. And just yesterday, the news of the death of one of my colleagues was brought to our notice. Dr. Philip Zwana died following Lassa fever disease complication. Dr. Philip Zwana died because he made efforts to attend to a Lassa fever case, eventually became positive to the disease, had renal failure, required dialysis, and unfortunately, in the entire northern part of the country, there was no place he could receive dialysis, and he had to be transported to ISTH Irua, where he was eventually dialyzed, but then it was too late. He died. Imagine a distance of over 350 kilometers for someone to get treatment. That tells you the status of our health institutions in the country. The outbreak of COVID-19 has yet again provided us with an opportunity to review and express how capable, how competent our health system in the country is in contending with outbreaks in the country. And it's obvious that the outbreak of the disease has shown the embarrassing status of our health system in the country. At the moment, as healthcare workers continue to play their parts in containing the outbreak of the disease, the healthcare workers are not protected. I just informed you that one of our colleagues died just yesterday to Lassa fever outbreak. And this is the state of our healthcare institutions, and that is the fate of most of our healthcare workers in the country. Dr. Philip Zwana is the 6th doctor to have died to Lassa fever outbreak in the country. And very little is done to getting this kind of situations under control. And for us, the healthcare providers, we are worried about the response the government is putting into containing outbreaks in the country. For us, we are very concerned because very little attention has been paid to the welfare of healthcare providers who are the frontline workers seen to the control of this outbreak in the country. As I just told you, Dr. Philip Zwana died, and just yesterday again, one of our doctors in ISTH Irua had tested positive to the COVID-19 disease. What that means is that these doctors that are testing positive to various diseases that are breaking out in the country have been left alone to themselves. There is no any form of life insurance being secured for them. There's no any form of compensation. And to say the least, what these doctors benefit at the end of every month as an allowance for the hazard they're exposed to remains the 5,000 naira hazard allowance they have been receiving. So we are worried if this fight against COVID-19, Lassa fever outbreak in the country is to be achieved, the welfare and well-being of doctors and other healthcare workers who are the frontline um, healthcare providers must be secured. I'm sure you will quite agree with me that it's not enough for Nigeria to continue to allow her healthcare workers to continue to die from one outbreak to the other. You will agree with me that we are currently suffering from a shortage of healthcare providers in the country. At the moment, according to the figures made available by the MDCN, there are less than 40,000 doctors practicing in Nigeria. And these are the doctors that are available to attend to the health need of over 200 million Nigerians. That goes to tell you that there are one doctor to over 600,000 people. And so this is far less than the World Health Organization's recommendation of 1 to 600 doctors, 1 doctor to 600 people. And if Nigeria is to catch up with the recommendation of the World Health Organization, they need to employ over 260 people, 260,000 people, because we are currently 10 times less than what is expected of us. And we cannot continue to afford and allow our healthcare workers continue to die as a result of the outbreak. So what I'm practically saying is that for the fight against COVID-19 to be won, the welfare and well-being of doctors and other healthcare workers must be secured, must be assured at the moment. And what we have at the moment is that we do not have that in place. What's even more worrisome is the fact that ever since this outbreak broke out about 1 month ago, we are yet to get what the plan of the government is with regards to measures that has been put in place to secure and protect healthcare workers in the country. We have not had any arrangement in place to ensure that when these doctors get exposed, they get some form of compensation. We've not had anything about what plans has been put in place to get the life of doctors assured generally. This is what is obtainable in any sane climb. You cannot have healthcare workers who are the frontline providers not having their lives insured. No health worker will give his best knowing that his life is not insured. No healthcare worker will give his best knowing that whenever anything tragic happens to him, his family will be left to nothing.
Right, Dr. Sokomba, just a moment. I'd like to get a figure.
Right.
Just a moment. I'd like to get a figure. How many of your members have been drafted, if we could just call this a war, in this war against COVID-19 in the country? Do you have an idea how much of your members are currently on the front lines right now?
Well, as we speak right now, in almost all the in almost all the treatment centers in Lagos, there are 2 infectious disease experts, one of which is our member. In ISTH Irua, almost all the resident doctors there have been put on standby, and they are available to attend to cases as they are coming. And out of these doctors that are already attending to cases in ISTH, that is the Irua Specialist Teaching Hospital, one of them has already tested positive to the disease. So across the country, wherever treatment is provided, doctors, at least 1, 2, 3 doctors are mobilized based on the number of patients that treatment center is having, and they have to contend with.
Right. Now, you've said that you don't get as much information from the government as you would expect on the plans and what have you. We understand that the government has announced, 100 billion naira to be pumped into the health sector, the 1 billion naira for the pharmaceutical industry, just from the government's end. And I wonder, if you say you've not heard from the government, is it that the government is not telling you anything, or when you ask, you don't get to hear anything? Even if you have asked, who did you ask? Let's know where the problem is here.
Well, thank you very much. Well, I think all the figures that has been announced so far, I also learned that over 15 billion has accumulated so far with regards to the donations that has been made towards the control of COVID-19. I'm not sure that amount of money has been distributed to any institution. I'm not sure any plan has been made or put on ground to use the amounts of monies that have been raised for the control of this disease. At the moment, I am not sure, and I stand to be corrected. Our hospitals have remained the same. Nothing has changed. Our hospitals have been what they used to be. In fact, they are worse off now. I want to tell you that as it stands now, there are institutions, federal, tertiary health institutions, that use, sun-dry their already used surgical mask with the hope that the sun will disinfect it so they can use it again. So the situation in our hospitals have remained the same. I don't know if these monies the government have been talking about are meant to be figures or they are meant to be put into use for what they are intended for. But as I tell you right now, nothing has changed and nothing has been put on ground to protect the welfare and the well-being of doctors and other healthcare workers who are fighting the virus.
So from your end, you don't see much. But, you know, some will say that, well, since hospitals naturally should not handle cases of COVID-19, they should be handled at the isolation centers. Maybe, is that perhaps a reason you're not seeing those changes at the hospitals?
Well, I think the hospitals have to, first of all, diagnose these cases or demonstrate that these cases are positive. And what that means is that while at the hospitals, the healthcare workers at these hospitals need to be provided with all that they need to work with, the personal protective equipment to make the right diagnosis, all that is required.
But Dr. Sokomba, our hospitals
also needs to be made.
If I may button, are hospitals accredited to test for COVID-19? Because we understand this is meant to be under the purview of the NCDC. So there are specialized, you know, laboratories and facilities to do that, and not hospitals.
I don't get you, please. Can
you said that hospitals are meant to test. And the question here is, are hospitals meant to test for COVID-19 or specialized NCDC laboratories?
Well, hospitals are supposed to give a provisional diagnosis of COVID-19. I think before a blood sample is collected for the testing, the laboratory testing of this disease, a diagnosis will have to be established. And this diagnosis establishment is done by doctors in the various institutions across the country. So as patients and other clients walk into our hospitals to find out if they are positive to this disease, doctors in these various institutions will have to, first of all, diagnose this patient. Will have to make a clinical diagnosis before a laboratory diagnosis is done, which in most cases is done from those treatment centers. So basically, the diagnosis, the clinical diagnosis will require that professionals in those health institutions have the necessary personal protective equipment they need to make those clinical diagnoses, which will eventually be confirmed by a laboratory diagnosis of the disease.
Well, first of all, our condolences to your association and people who have lost loved ones in your profession. But you've said repeatedly that you haven't been getting the kind of support you needed from government or the authorities in the discharge of your duties, especially now that we are fighting a bigger enemy. What is the standard, the minimum standard a doctor or a health worker should have before going to face this kind of infectious disease? And how come you don't have these materials, these facilities, yet your members still go to war?
Thank you very much. The minimum standard is that, first of all, for any doctor to be drafted into the battle to fight coronavirus disease, the health of that doctor needs to be ensured. That doctor needs to know that his family will be taken care of, at least when whatever happens to him, the health of that doctor needs to be ensured. Secondly, there should be arrangement for compensation should there be any calamity, and should any calamity befall such doctor. So there's a need for compensation arrangement to be made. Thirdly, personal protective equipment needs to be made abundantly available for such doctors to make use of in the field while fighting and battling and contending with the virus. And lastly, doctors need to be adequately trained. This is a novel disease, and there's a need for training. I must tell you that there has not been any arrangement for training of any healthcare workers, and you can confirm this, that the 2020 budget of the country does not have any provision for training and retraining of healthcare workers. That means there is no provision for that. So as it is right now, things have continued to remain the way they were before the outbreak of
Dr.
disease.
Sokomba, this is not the conversation, this is not the information we have from the Minister of Health and Minister of State for Health, as well as the Commissioner for Health, especially in Lagos. They said that people who are supposed to be involved in this, in the fight against this pandemic, have been adequately trained. Does that mean that your members were not involved in the training?
Well, perhaps the training has not involved my members because I am not aware of any training involving resident doctors as they prepare to contend with the outbreak of the disease in the country. And I think this is particularly important because this disease is a new disease, and owing
Dr. Sokomba,
to the,
one moment.
natural history of this
One
disease.
moment. My colleague asked the other time, who are you interfacing with at the federal level, maybe the Federal Ministry of Health, or who exactly are you, have you interfaced with, and what kind of responses have you gotten?
Well, at the outset of this outbreak, we had a stakeholders meeting that was conveyed by the Director Hospital Service of the Federal Ministry of Health. We were asked to make proposals, which we did, and that was it. We never heard from them again as to what plans has been put in place to see that this outbreak is contained adequately. And since then, we have not had anything. The Director Hospital Service of the Federal Ministry of Health, and we are hoping that a response shall be transmitted to us soonest.
What would you want to be done to make your members happy such that they can work well during this period?
Do I want to be?
What would you want to be done to make your members happy at the moment?
Thank you very much. What I want is that I want, as our members embark on this solemn journey, that they have a life insurance. There's no way our members will give their best knowing that they don't have any form of insurance cover should anything happen to them. I want the little hazard allowance that has been paid to our members. That hazard allowance had remained 5,000 since 2009. You'll agree with me that you will give up 5,000 over and over again to avoid any form of hazard. And so I think there's a need for that to be reviewed. I also think there's a need for all the healthcare workers that are roaming the streets, doctors that have not been employed, to be mopped up. This is the time to have everybody on board. Other countries are trying all their possible best to lure doctors from developing countries into their country. Even as we have shortage of them in this country, we are doing little to mop up all other doctors that have not been employed. I think there's a need to employ all these doctors that have been roaming the streets. There's a need to increase the strength, the number of human resource we have in this country. There's an urgent need for that, and there's a need for the government to demonstrate adequately that the healthcare workers in this country who have benefited from the national resources of this country to have been trained as doctors are needed. They are valued and they are required to remain in this country. Just recently, 2 weeks ago, I saw an advert from the United States advertising that doctors from developing countries can join them to fight the COVID-19. There's a need for Nigerian government to see the need to harness all her resources, those that have not been employed, those that have been employed to be motivated so that they can fight this virus disease and other viral disease outbreak in the country effectively. And lastly, I think there's a need for adequate equipment, such as personal protective equipment, such as face masks, gloves, gowns, to be distributed widely across the country to all institutions in the country, so that these things can be available for those who are putting their lives in the line to make use of while attending to cases,
all right, just
confirmed cases as the case may be of this disease.
Give us your thoughts on this before we wind down, if you could make it as brief as you can. Speaking about what you mentioned about those adverts, even though they've since responded about the appropriateness or otherwise of that particular narrative, but is there any such patriotic considerations or drive on the part of your colleagues, maybe your association as well, to ensure that doctors put Nigeria first and not leave, the country to other countries?
Thank you very much. The reason some of us, or I will say all of us, healthcare workers have remained in this country is because we are patriotic. If you are to consider the pay, the care, the value, the job satisfaction, no doctor will remain and practice in this country. The reason all of us that have remained in this country are still in this country is because we are patriotic. You can imagine a country like United States that is making all the things, may not necessarily be perfect, but at least no doctor is practicing in United States that does not have a life insurance. And I want to tell you that no doctor in practicing in United States that does not have the equipment they need to work with. And to make matters worse, all the doctors in Nigeria have the capacity to be in those different places across the country. It doesn't take much. We have what it takes to practice anywhere in this world. The reason we have remained in this country is because we are patriotic and we're willing to do our part to make sure that the health system of this country offer what it is meant to be, to offer to Nigerians.
All right, Dr. Shokunbo, Ali Shokunbo, President, National Association of Resident Doctors, thank you for your time this morning, and we wish your members all the best. So there you go. Yes, hopefully, by the time they have the latest round of the PTF, they should raise this with officials right there with the PTF. Maybe the Minister of Health can escalate it to SGF and then to the government, such that they know this is the feeling, the thinking of some professionals. So how will they respond to them?
And it's important to also know, like he said, he started by saying, we're also fighting another war against Lassa fever right now. In fact, the number of people that have died due to Lassa fever is way more than people infected, not even people that have died, people that are infected with COVID-19 in the country. So he mentioned that, and I know a couple of people have said that, yeah, well, we're focusing on COVID-19 and doing a lockdown, and people are saying, why didn't we even try to do a lockdown for Lassa fever also? Because, I mean, apparently Lassa fever is more deadly than COVID-19 here in Nigeria. So I think this should help us to weigh our measures moving forward for other, forms of diseases like Lassa fever, which is a big deal right now. So while we're focusing on COVID-19, we shouldn't lose sight of the other war against Lassa fever.
And if there is anything to add to that, would be the fact that this is a time that we need all health workers together, in one pool. Because if this section is having this opinion that they're feeling shortchanged, who knows what's in the minds of a number of other health workers, other segments of the the medical profession in Nigeria, who should all be hands on deck on this matter. So this is definitely a call for concern.
All right, then. So we'll bounce it off someone who should be in a position, perhaps empathize, and then should also be able to provide or talk about solutions to some of the challenges being highlighted by the doctors. That will be in a moment. Stay with us.